Hello, my name is Tracy Stiller. I'm a physician. I've had the opportunity to participate in a medical service here in Thailand through IMRs funded by Make a Difference Foundation, and wanted to talk a little bit about why I chose and why we're here. I always feel that part of our lives is to give back a little bit, and so this was an opportunity that presented itself at a time in my life that I could come and work here in Thailand. What I found has been the biggest impact in the clinics we've run is to bring education into the local community. The system is set up that a patient could go to a local pharmacist, tell them their symptoms, and that's the rooster. Tell them their symptoms, and the pharmacist will give them a medication. Sometimes it helps, and sometimes it doesn't. But there's no education as to what they're trying to treat. They do have some access to doctors, but very limited. So much of the people who came in, although they were perhaps taking a pill for diabetes, didn't understand the impact of their lifestyle choices on their blood sugars. Very motivated people, a lot of them, who came and presented to clinic because they wanted to do better, but they didn't know what it is. And so, for example, one of the local favorites is something called sticky rice, where they add a mango and sweetener into the rice. And so for diabetics, such a troublesome snack, and yet they didn't understand the impact of what that would do to their blood sugars. I wanted to take the opportunity to share one story, and as we did our clinics, we realized that there were needs and patients in the community that weren't able to come to our clinic, and so had the flexibility within IMR to come up with home visits. And so we would take a group of a physician and several nurses and support into someone's home. And what we've learned here is, number one, the families care. A lot of times it's a very caring, supportive environment, and the caregiving is excellent, but giving the caregivers and the patients the understanding of what's going on will lead to a better outcome. Talking about a bedbound patient and pressure points and how to prevent those, what the complications are and how to keep someone healthy. A patient with kidney disease, with swelling in the legs, teaching them that keeping their legs elevated several times a day and how to help with the swelling because they can't take more and more diuretics, and helping them understand why their doctor said no more diuretics, helping them understand what to do so that their kidneys don't get injured again. That education cycle has been so important, and that can be brought in from all members of the team. We have well education, children's education. We've gone to an orphanage and did young women's education, talking about the menstrual cycle and the questions that were asked tell us that these people want to know what to do better, and to be able to step in and bring that and offer that. Anyone can step in and cure an acute problem, but to give that education and for them to be able to teach their friends and bring that back to their communities, that's what I found was so valued by the patients and could lead to a lasting difference here and on this visit. I take the opportunity to just thank Make a Difference Foundation for the opportunity to help and serve. Thank you.